Good news, your prostate got big. Congratulations, you lived a long time. Here's hoping it gets bigger, you live longer. And here's hoping, I know this sounds weird, that at some point you're going to develop cancer cells in the prostate gland, because that is inevitable if you live long enough, and they'll just stay there and they won't bother you as long as you don't disturb them. So enlarged prostate, it's a reward for long living. Managing it, yeah, you could do that. And some of those supplements I mentioned, start them early. It just makes sense. Like, you're not going to hurt yourself taking tomatoes 3 times a week, unless you're allergic to them. Every man will experience gradual enlarging of the prostate gland over the span of their lives. In some cases, it can get to a point that it becomes symptomatic. Now, the good news is, hey, you live long enough to have it happen. One way to avoid that is to die young, which I don't recommend. But when does it become worthy of attention? This, folks, is strictly a functional question. There is nothing about a big prostate that is injurious to your health unless it affects urinary flow and function. So the size of it is not always the most important variable, but rather where it's gotten bigger. So think of the prostate gland like Mickey Mouse ears. The outer lobes, if they grow outward, it's not likely to impair bladder function so much as if the inner lobes are now pinching the urethra. And how can you tell this is all happening? I mean, there's a ton of imaging studies that are available, but the biggest factor to consider is your function. Can you pee? Yes or no? Can you pee in a manner that enables you to empty the bladder to your satisfaction? It's not critical to have the same flow that you had when you were 30 at 60. That's unlikely. But keeping a good urine flow such that you can function without having to worry about where's the bathroom all the time, or not having to wake up with such frequency that it affects your daytime energy. Waking up at night is not injurious to your health as long as you can fall back asleep and you get adequate sleep to be restorative. At some point, that adequacy can be impaired by frequency. At some point, problems can arise due to poor flow volume, poor speed of urinary flow. Recurrent infections and other problems can happen. So what should a man do? Or I suppose a question worth asking, why does it happen? Well, we're not sure. There may be genetic connections, age is a factor. And here's one thing that's not a factor, folks: testosterone. Gentlemen, do not blame your testosterone on your prostate getting bigger. In fact, it gets bigger as testosterone levels decline. So that just makes no sense. And if you want to go on testosterone therapy, have at it. There's no good evidence that taking testosterone therapy will accelerate growth of the prostate gland. It just happens to correlate in some men, but in my experience, and I've been doing it for 20 years now, it's not a direct correlation, and theoretically it may be a benefit. So how do you know you need it addressed? Simple. It's bugging you. You're not happy with the way urine is flowing. You want to get it addressed. You start with the very basic things to support the prostate's health, to perhaps shrink it and improve the flow without surgery and without procedures. I'll be talking about procedures in a moment, but keep those on a back burner, guys. Be patient. This takes some time. And by all means, when you get this evaluated, do not let them scare you because your PSA is elevated. You have a large prostate. Your PSA is going to be elevated. Those two things go hand in hand. It doesn't mean you need a biopsy. Never do I want to see men get needles stuck in their prostate gland. Go back to my original podcast on that. So that should never enter the conversation, right? But how do you know if it's cancer, saith the man, or saith the urologist, right? They like sticking needles in you. It's objective evidence of something. the best way to distinguish between benign prostatic hypertrophy, or BPH, and prostate cancer is monitoring the condition over time. There is not a single study on the planet, not even a biopsy, that can absolutely declare your condition. The biometrics, the PSA, the prostate health index, the urinary studies, they're coming out with more advanced testing all the time. The problem they all have is that they're not reliably diagnostic. They just kind of help tilt the averages. What matters the most, sequential assessment. And I still like a PSA. It's not diagnostic for prostate cancer, but observing its pattern over months and years can be helpful. It should, and it will, go up slowly and gradually. It does not mean you need a biopsy. For God's sakes, you never need a biopsy. But you may want to intervene to help the prostate to shrink. So what things can you do? The prostate gland responds to inflammation. I've had men go on a flight, and after they got to their destination, went into complete urinary obstruction, couldn't pee at all, needed a catheter, had to go to the emergency room. What happened? The flight exposes you to ultraviolet radiation, which instigates free radical overload. So if you're in a circumstance where your free radicals are amplified, you're going on a flight, you're under mental or physical duress, you're battling an illness, bump up your antioxidants. Chief among them, vitamin C. 2,000 milligrams every day is totally safe, and it can be done a couple times a day if needed. I don't recommend taking above 2,000 milligrams at once. The body can only absorb so much, and the blood levels will be plateaued. So vitamin C, when you're under duress, watch inflammation. The other thing that can help, if you're in a position of trying to protect your prostate against an acute increase in its inflammation, actually non-steroidal anti-inflammatory drugs, over-the-counter ibuprofen, 400 milligrams. As a preventative, if you're going on a flight and you have a prostate that's a little bit twitchy, some men will take it at dinner and will note better urinary flow or less nighttime urination. That can also occur. Well, what about things in the supplement world, in the nutritional world? In the supplement world, it seems like blends are best. There's not a singular supplement that has been shown to solve the problem. However, they can be helpful. And if you're going to use supplements, gentlemen, stick with it. You need 6 months to judge an impact. It's going to be slow. It took you years to grow that prostate. It's not shrinking overnight, right? Saw palmetto helps to lower dihydrotestosterone, or DHT levels. Combine it with a few others. I'm going to read these off. These are the ingredients that I like to see. And you can find these in over-the-counter supplements. There's beta-cytosterol, pygium africanum, stinging nettle, and lycopene from tomatoes. Also, zinc. Keep your zinc not greater than 30 milligrams a day, by the way. Too much can be bad. Lycopene is the stuff that's in tomatoes. In fact, a tomato is a better source than a supplement because it has other things in it besides the lycopene that may be effective. I recommend 3 servings a week of a dark red tomato. Plum tomatoes are the best. They have the most lycopene. Cherry tomatoes can work as well. Hey, if you don't tolerate tomatoes, a supplement is totally cool. But be patient. These take time. They take time. Functionally, what else can you do? I mean, the obvious stuff, not drinking before bed, etc. But none of those things are going to shrink the gland. Supplements may help do that. What about in the pharmacological realm? I mean, there's some things that I love. I love tadalafil for my patients. Cialis, yes. The same drug men use to enhance erections can help urinary flow. 5 milligrams a day every day. You don't take this just when you're going to have sex or just when the prostate doesn't appear to be functioning well. Take it every day. It's safe. It needs to be physician prescribed, of course, but it also has correlated with decreased incidence of heart attack, stroke, and dementia. I mean, think about it. Better urine flow, better erections, less heart attack, stroke, and dementia. What's not to like? dose extraordinarily safe, typically 5 milligrams up to 20. There are a couple of drugs that have been FDA approved to help shrink prostate gland. One of them is finasteride, the other one is dutasteride. They both work by blocking DHT or dihydrotestosterone. DHT is one of the metabolites of testosterone that does correlate with gradual enlargement of the prostate gland. Taking either one of these drugs over months can slowly shrink the gland. Side effects: in some cases, men experience impairment of their sex drive or their erections. The incidence of this is hard to know. You read the package inserts, they'll say it's maybe 1 or 2%. You talk to men at large, and it seems maybe more than that. I can tell you it's variable. And there are many men who have absolutely no impact on their sex drive nor their erections when they're on these agents. They take months to work. Tadalafil, Cialis, that can work more quickly. Now we're talking about improving the flow, maybe shrinking the gland. The other thing that can help, though I'm not crazy about it, it's tamsulosin or Flomax. Tamsulosin works by relaxing the sphincter muscle of the urethra, enabling urine to pass more freely. The thing I don't like about it can cause lightheadedness and it can cause retrograde ejaculation. When you have a climax, nothing comes out. It goes backward. Not quite as satisfying as a normal ejaculation. But if you're in a position where there's an acute demand, you're at risk of having total obstruction, it's reasonable to consider while you're on the other drugs that are shrinking the gland or the supplements that are shrinking the gland. You can combine these things, supplement plus prescription. How do you know how things are working? Well, you simply determine how you feel. How long can you go between urinating during the day? How about at night? I was waking up 4 times a night. Now you're down to 2. That's progress. You can do what's called a pre and post void residual. The doctor can do an ultrasound of your bladder, see how much urine is there. Then you'll go empty the bladder and they'll repeat the study and see how much is left over. A large post void residual is indicative of impaired flow of the urine that may be starting to become clinically relevant. So the enlargement of the prostate affects the bladder by making it work harder. Your bladder has to push with greater force to get the urine through a tighter space. That leads to detrusor enlargement. That is, the bladder gets thicker. It's a muscle. And when it's exercised like that, it gets bigger and more forceful. That accounts for that sense of urgency men get, right? One moment you're feeling fine. The next moment, holy cow, you feel like you got to get to a bathroom right away or you may pee your pants. That's urgency. That's a sign of the prostate impairing the flow and the bladder itself trying to compensate by pushing harder. These conditions can be improved by the pharmacologic and the supplement regimen I just shared with you. Be patient. Do not rush for a surgical remedy. They hurt. They have complications. Although, in the right setting, with the right hands, they can be life-enhancing and quite valuable. So let's touch base upon those. The old standard is a transurethral resection of the prostate, the TURP, where you'd go in there typically with a electrodesiccation device, just cutting away, shaving, if you will, whittling back pieces of the prostate gland to help open up the space. Problem with that is potential scarring, stiffening of the urethra, post-procedural failures. I would say that procedure has given way to newer interventions. One which is very effective is called the HOLep, H-O-L-E-P. That is the holmium laser enucleation procedure. As the name implies, it involves going in the urethra and then with a laser carving out large chunks of the prostate gland that are encroaching on the urethra. Those large chunks are actually pushed back into the bladder, and then they use a special device to break them up and suck them all out again. What's good about this? I like the fact that they're using the laser, because one of the questions comes up frequently. If you do a procedure like that, is it going to increase your risk of metastatic cancer in the event cancer cells are subsequently found to be present? So the tissue they carve out, they're going to analyze it, and if they turn out that they find cancer cells there, the HOLep procedure, because as the laser is cutting, it's also cauterizing. So in my opinion, based upon how the procedure is done, it's much less likely to create dissemination of cancer cells than, for instance, a prostate biopsy or some other surgical procedure. This procedure is one of the more successful ones if you count success by not needing something else later in life. It's been around long enough so that we know some of its potential downfalls. And one of those, retrograde ejaculation, men. You ejaculate and nothing comes out. So I had one patient jokingly say to his wife, well, honey, there won't be so much to clean up, right? If that type of an outcome is not disturbing to you and you have a particularly large prostate, this may be the procedure of choice. It works well almost regardless of the size of the prostate. That's not true for all the other procedures. Now, here's an important caveat for the HOLep, for really any procedural intervention in medicine, period, but particularly in your prostate, guys. You got one shot to get this right. Do not buy at the first store you shop in, right? Get a couple of opinions. And I advocate that one of those opinions should be at a tertiary care, high-level academic institution that does lots and lots of the procedure. You may have a lot of respect for your neighborhood urologist, and she may be excellent, he may be excellent, but I'm biased in favor of centers that just do this type of thing all the time. I've seen very different outcomes for my patients. I had a patient flew to the Mayo Clinic to have his Rezūm procedure done. Man, he had a fabulous outcome. Compared to another patient who had it done locally, struggled. Now, it could be the individual variables, but I like the specialty centers. So HOLep gets my endorsement. If you need something and you're really symptomatic, and right, be patient. The 6 months of non-surgical treatment didn't quite work. How about Rezūm? R-E-Z-U-M. No, it doesn't stand for anything. It's a trade name they made up, like Kleenex or something, right? So the Rezūm procedure uses hot water, in essence, to kind of burn a way through, opening up the pathway. What's good about it? Very little to no effect on sexual function. And it's easy to do relative to the others, right? Oftentimes it's a same-day procedure. The HOLep, sometimes it's an overnight stay with anesthesia required. Rezūm doesn't necessarily need the same amount of anesthesia. It can be done locally. It'll take it longer to be effective, several weeks, perhaps longer, for gradual improvement to occur. And it's not great if you have a very large prostate. There is a size cutoff that you want to be mindful about. But it does not cause retrograde ejaculation. It will not interfere with urinary flow or erectile function. A nice choice, but choose wisely. Go to the places that do it all the time. So we talked about HOLep. We talked about Rezūm. How about the UroLift? The UroLift. All right, I don't like it. It's like, why don't I like it? Because they're putting stuff in you. They put a plastic device that is intended to lift the prostate out of the way of the urethra. It sounds good on paper. I can't tell you, though, how many of these put plastic device in me procedures end up 5 and 10 years later becoming a major pain in the neck. Plastic devices can fail. The device can corrode through tissue. It can become a nidus for infection. It's foreign material. It has no blood flow. Bacteria love to grow around such items. So I just don't see its merit. Use the Rezūm. Use a UroLift. I'm sorry, not UroLift. Use the HOLep or the Rezūm. I don't like UroLift. I would not recommend it. Anything that puts a device in your body, you got to think 3 times. Do you guys remember, probably not, that donut, the gastric banding they used to do? Like they thought that'd be a good idea. Those horrible things started corroding through people's anatomy. Not good. Avoid putting junk in the body if you can, particularly because you got better options. There's also prostate artery embolization. In this procedure, an invasive radiologist goes into the artery and then uses plastic beads typically to block off the arteries feeding the prostate gland, thereby, in essence, killing it, having the cells die off so that they gradually shrink. Very operator dependent, very operator dependent. No two docs are going to be the same at this. I have concerns about its risk because it is difficult to tell from the literature, since every doctor will have a different level of skill. And if you're contemplating this, you most certainly want to scrutinize the person behind the procedure. So I'm a little reticent. The good thing about it, there's less disruption of cellular material, can shrink the prostate gland kind of globally, but there's a risk of needing repeat procedure. Kind of like the HOLep a little bit better than the prostate artery embolization. So some of the key things regarding it, the procedure that is, you want to be mindful about what you value. If the idea of retrograde ejaculation is disturbing, think twice about HOLep. If the risk of a relapse procedure is disturbing, think twice about Rezūm, because of the potential for relapse is greater with that. The same thing with the arterial embolization. Think 10 times about the UroLift. Look, some people out there are going to brag about how great it is. I don't trust it yet. I want to wait 10 years and then do a look back and, see what's going on. And again, when you have not better, but you have alternatives that don't require that, so much the better. How about in the functional world? What else can we consider? Methylene blue is getting some play. Methylene blue is an anti-inflammatory. It neutralizes free radical overload, and as such, might it impart a benefit to the prostate gland? It might, but there's just not enough clinical experience with it, nor enough research evidence to give it a hearty recommendation. If you're inclined to try it, make sure it comes from a compounding pharmacy, not from a supplement supply store. But I don't really endorse it for that purpose, even though on paper it looks like it may make some sense. Another tip that I'll occasionally use for my patients who are having nighttime urination in particular is a hormone called Desmopressin. It's a prescription drug, DDAVP. It is an antidiuretic. It's a hormone that cuts down the amount of urine that the kidney makes, thereby compelling you to pee less at night. This drug is sometimes used for children, young boys in particular, to help prevent bedwetting. And it has the same effect on old men who are now peeing a lot at night by virtue of lowering the amount of urine produced, potentially give them a better sleep cycle. It's an off-label use. You can ask your doctor about it. It's all capital, DDAVP or Desmopressin, a hormone used at night. The ibuprofen idea I mentioned, worth trying as well. What happens if you do nothing about enlarged prostate? Nothing. It'll perhaps keep getting larger. And at some point, you may choose to do something about it. But it's very much your prerogative, driven based on how you're feeling, how the symptoms are affecting you. If you get sick, if you get infected, the prostate can become temporarily enlarged. Prostatitis is a form of prostatic inflammation. It can happen from infection. It can happen secondarily to infections elsewhere. We mentioned the flight, getting the flu. Anything that will inflame you systemically can have an effect on the prostate gland itself. Although it's intriguing, ozone suppositories are unproven. So an ozone suppository, these are gel suppositories, go in the rectum. Ozone has anti-inflammatory value. And these ozone suppositories, you can Google them, O-Z-O-N-E, ozone. You can purchase them online. They're extraordinarily safe. They have to keep refrigerated. I think it's reasonable to try because of its potential benefit. Anti-inflammatory. It's benign. The action of putting a suppository up the rectum, it's not everybody's idea of a great moment, but it's quick and easy. So you have my support if you want to try that at some point. I would suggest if you're going to try it, give it a 3-month cycle and then do a look back. And if you notice benefit, you can maintain the course. Well, folks, good news. Your prostate got big. Congratulations. You lived a long time. Here's hoping it gets bigger, you live longer. And here's hoping, I know this sounds weird, that at some point you're going to develop cancer cells in the prostate gland because that is inevitable if you live long enough. And they'll just stay there and they won't bother you as long as you don't disturb them. So enlarged prostate, it's a reward for long living. Managing it, yeah, you could do that. And some of those supplements I mentioned, start them early. It just makes sense. Like you're not going to hurt yourself taking tomatoes 3 times a week, unless you're allergic to them. Well, folks, wishing you guys smooth sailing, easy urination. No, you're not going to write your name in the snow anymore, but you should be able to get through your life just fine with minimal intervention. And if the moment comes that a procedure is needed, heed my advice. Don't buy at the first store. Shop around. Don't be afraid to make a regional trip. This is a one and done. You want to make sure you get the best care available. Thanks for tuning in. We'll talk to you next time.